played, but it's so great to see you guys. As I mentioned, I've done a lot of these conference calls during COVID. I was doing one every like week or 10 days in the thick of it. Most of you remember it. I think that's it's a bitter, very bitter, but sweet as well, because saying that right now, reminiscing about that right now, can also tell us how far along we've come. And those days were definitely sad days, gray days for all of us. We didn't know what the future would hold. But we can say right now that definitely this COVID uh, virus has changed. Thank goodness for the better. It's becoming a less virulent virus. It's becoming less serious in terms of the condition that it causes, in terms of the numbers, the sheer numbers of sicknesses and hospitalization and deaths. So this conference call is just an update to give you kind of a state of the COVID. It's not as you know. State of the state address, but it's more like a state of the COVID infection. And I'll take an opportunity, considering that flu and RSV season is coming up as well, to give you some indications and some more information about the new vaccinations schedules and what to look for. All right. So I'm gonna just go ahead and mute everybody right now. Let me see if I'm able to do so. So at least there's not gonna be any feedback. Let me double check here and see here. Yep. Okay. And then I'm gonna open up the mic for Q and A's after the presentation. So the question that I get from everybody, remember at one point at the very beginning, all the major cable network TVs, they were giving us not only sheer numbers, but they were giving us like clocks and calculators about the numbers. You could see the cases on a daily basis, almost on an hourly basis, and everything else. Thank God that's not the case anymore. And also remember this: one of the reasons why we cannot do that anymore is because we don't have the protocols that we used to have before. Before, in order for us to diagnose somebody by COVID, these patients needed to go either to the hospital or to be tested with one of the standardized testing at either CVS that were reported to the states. Now we don't have that anymore, and of course, most people test at home. Some of them don't test, which I always discourage. A lot of times I get some phone calls about people getting a little cold, a little cough, a little feeling not right. And my first question is always, did you test yourself for COVID? And that's very important. First of all, because it can help us out. If you know that that's COVID, that's great. And plus, at least you know what to expect and what we need to do. If it's not COVID, and remember, if you test too soon, it might be negative. So always make sure that you test a couple of times, 2 days apart, because otherwise, even a negative test might not mean that you don't have COVID. But if you do have COVID, then we know exactly what we're due for, what we're dealing with. You know how to protect yourself and others. Masking yourself up. One of the questions is what kind of mask. Nothing has changed. From the very beginning, I always recommended only the KN95s. It's more of a reason now to use it because there's wide availability. We still have a few available. You don't have anymore. But KN95s, I don't want to see surgical masks like handkerchiefs around it, scarves. They don't work. If I travel and I'm on a plane, the best way to protect yourself, besides using a mask, which right now it depends on how sick you are or what kind of comorbidities you have. But if you're on a plane, one of the best ways is to direct the spout of the air conditioning just in front of your nose, so you can feel the flow of the air. Because by doing so, the air that comes from there, it's filtered, and by doing so, it disrupts the flow of the air. And so if somebody sneezes not too far from you, it might just avoid those droplets come in contact with your nasal area and your respiratory tract. So that's one of the little tips that I'm giving you when you travel. Otherwise, where is COVID right now in the United States and in Connecticut? Right now, the test positivity, and remember, I told you that before, we cannot go really all by that. Test positivity means how many of the tests, the standardized tests that the pharmacies do or the ERs do, they turn to be positive. So it's about 17%. And at one point in the thick of it, we were in upwards of 70%. So definitely it's still low. It was lower. And if you see any curve that shows hospitalizations, ER, visits, for example, and even death sometimes, you'll see that there's a bimodal curve. So in other words, there's a side at the end of last year that came down quite decisively, and now it's been low for the last few months, and now there's a little increase again. Since when first COVID showed up in early 2020, we've always had these bimodal curves during a year. Usually you will have a spike, which somehow, and there might be many components to it and might be a reason for it, and somehow it's always around after Thanksgiving, around the holiday season and New Year's. And so that's one of the times when you have to be very careful. And then there's another one, not as significant, but there's another one where we're in right now, sometime in the summer. And the scientists still don't understand why that happens, because logically, if you think that COVID gets spread in closed spaces, for example, where the ventilation is not that great, you would think that when people go out there, they would be less susceptible to that. But it's also true that in a lot of places the heat is very strong, and so a lot of people spend a lot of time indoors because of the air conditioning. So we have to really be careful. And so remember, even the summer can be a spreader. So I was telling you 17% test positivity, and emergency department visit, a percentage of patients diagnosed as COVID-19 in the ER, all visits, is about 2.3%, which seems to be pretty consistent with what we've seen the last few weeks. Hospitalizations are 3.3% of all people with the percentage with COVID. And that's only 1.5%. So that's a great thing. At one point, that's where really significant. The hospitalization were upwards of 70%. That's where in the 20s. So we are definitely a far cry from what we were where we were about 4 years ago. But we still have to be careful. And why do we still get COVID after all the vaccinations, after the virus has mutated so many times? And that's one of the reasons, the mutations, the variants, so-called. This virus has a RNA sequence, and from the very first virus that came out of China, or wherever they came out of, the viruses have changed that sequence every single time. That's one, I've said that before. That's one of the ways that natural selection helps the virus modify itself when the host, which is the humans, which is us, gets to be defended better by getting COVID itself, which is natural vaccination, and by getting artificial vaccination, by getting shots. And so over the last few years, past few months and 4 years, it's amazing how there's going to be, there have been so many different variances. I have the list of variances right now. Just in the Omicron variant, there's about 28 subtypes. It's amazing. And the latest one, probably you've heard them on TV, they're called KP2.3, KP3, and KP3.1. There's also another one that's probably about 13%. That's LB1. These are all variants for the Omicron. Omicron is one of the variants that came out. You remember the Alpha, the Delta, the Omicron. So the Omicron has been around and has been the dominant strain for the last at least 2 years or so. And the subvariants are constantly changing. As I said, the good news is that they're not as strong. They don't make people as sick, most likely also because almost everyone has been vaccinated. I was looking at the rates of vaccinations in the United States, and I must say that that Connecticut and the Northeast in general do a great job. I'm looking at them right now, and for example, the vaccination rate is about 83%, and the at least people who have had at least one dose, it's about 93%. There are some states where these rates are in the 70s, and even young patients between 18 and 35, their vaccination rate, at least for the one dose, they're upward of 70%. So we have a good community that is being vaccinated, it's being protected. Now the question is, how do we go along? How do we really face these new strains that allow the COVID to still be able to attack us and to make us sick? First of all, the symptoms of COVID. The symptoms that change, they change with every variant for the most part. We don't have the metallic, remember the loss of taste, the loss of smell that was really particular of the first strains. But now we have more of an upper respiratory symptom constellation. We used to have really bad lower respiratory tract. That's why people end up in the hospitals. That's why people had really bad pneumonitis, as we call them, very bad inflammation. We used to have to give them steroids to fight them. Now instead, it's more like an upper respiratory infection. Now, people will say, hey, listen, I have a allergy, or I have a postnasal drip, or I have a sinusitis, or my throat is a little sore, I don't feel right. The cough is not as common as before. It's still a dry cough, but it's not as consistent or severe as before. We'll have people just cough a little bit every once in a while, but we don't have the coughing fits that used to take people to the hospital, where people were hardly be able to breathe. So I think right now it's definitely the symptoms are more bland than they were before. Just remember, every time you might have a cold, quote unquote, and you have a postnasal drip, always question that. Once again, not just to protect yourself, but protect the others who are around you. And always try to isolate. If you're not feeling sick, if you're feeling sick and you haven't tested yourself, just wear a mask. Even if you test yourself, remember, don't take 100%, because sometimes you test yourself too early. Those antibodies are not really up yet, and so you better test yourself a day or two after. The tests are still available in the pharmacies. There's plenty of them. They're not covered by the insurances anymore, but they're relatively inexpensive. So I would say probably you'll get a box for $25, which and each box contains two tests. So definitely something you want to invest on. In terms of, as I said, for example, the number of deaths last week were only 340, and this is all across the United States. So we're saying, probably in Connecticut, we're probably in the single digits. And remember, these are probably from people who are really sick and where COVID might have been a cofactor for it, might not have been the ultimate reason for their death. Now, it's very changed from the very beginning. Before, remember, we used to have the medications, the remdesivir. We used to have the steroids. We never really had an antibiotic because it's a viral. It's like the flu. It's a viral condition. So unless you really have gray, green, brownish sputum, which might herald a bronchitis or an impending pneumonia, and you do need an antibiotic at that time, you really don't need an antibiotic for COVID. But it's important. It's very important at this point to really two things. One is the vaccination, being up to date with the vaccination, and the second is that we do have antivirals that are very effective. They've been around for quite some time now, and they're able to be dispensed by us, to be prescribed and dispensed by the pharmacies in the area. So let's talk about the vaccines first. So the vaccines, we're still stuck at the vaccine from about 2 years ago, which targeted the Omicron strains that were circulating at that time. Nothing has changed. But of course, remember, the main sequence is still the same. There's some changes that might not be covered by the vaccination, but any vaccination, even as old as 2 years ago, still gives you a level of coverage that it's much better than not getting any booster. Um, there are a couple of vaccines that are coming out, and they should be out in the next few weeks. They said between August and September. They usually always delay a little bit, so I wouldn't be surprised even in this case they would come out in October, November. But if the CDC, if we want to just believe the CDC and the latest sources, official sources, I would say probably we're going to have new vaccine, new boosters in October, at least in September, October. And I would definitely encourage everybody, once again, because this is a new coverage with updated strains from probably July, because that's when they were officially approved by the CDC and by the FDA. And so they're coming up. I understand that one, they're still doing the clinical trials, is going to be in combination with the flu. It's a particular one because the flu changes every year. And so probably they're not going to produce a lot of doses because otherwise the next year they will not be applicable. But in this case, it's definitely, they can definitely be taken together. And I would definitely encourage you, no problem, unless somebody is sensitive to the flu or the COVID in the past, and I know who I'm talking about, you guys know who I'm talking about amongst yourselves, in that case, I would definitely not recommend it. But for the most part, if you've never had an issue with COVID shots, if you've never had an issue with the flu shots, it's definitely good for you to take either the two shots together or the one shot, the combined shot that's going to come out. When is the best time? So most likely, as I said, I would say let's give precedence to people who really need it the most, which is usually the over 75 with and the ones above 65 with chronic severe conditions. And I'm talking about diabetes, heart disease, kidney failure, cancer, of course, chemotherapy. People who've had chemotherapy in the past, that's one of the main risk factors. So, just make sure that if you belong to that category, definitely be one of the first ones to be in line, or at least to go online and just schedule your booster shot. We'll let you know when the booster shots are available. We're going to send you communication. We're not going to do them in the office because now we're using Bascare, which is a state encouraged program that covers most of the insurances, but there's such a disparity about coverage now, among the different insurances, that it's really complicated. So for COVID shots, definitely refer to your usual pharmacy. And Moderna, Pfizer, we still don't know who's going to come out first. But remember, you can mix and match, no issues. Moderna seems to have had the edge in terms of results and outcomes, clinical outcomes over the last few years. So, but even if it's Pfizer or one that you did not take before, no problem whatsoever. Whichever one, it's fine. Remember, once you get the shot, you still cannot get any COVID shot for at least another 2 months, and it's not recommended usually. I would say probably right now, you're definitely going to be good for at least 6 months, 12 months after you get the booster shot. Most of us are coming to, it's been over a year since we've taken the updated booster shots. But as I said, I would definitely favor the older and the sicker patients to go ahead and have it done. In terms of these boosters, they should last a good amount of time. And if you did have COVID, you cannot get any booster shot for at least 3 months. And there's really no reason. If you had the latest strain of COVID, you basically had an injection with the best vaccine possible, because it's actually give you an immunity to the actual strain that's circulating right there, right now. So I hope that answers a lot of these questions. So definitely we're looking forward for these vaccines. Going back to the symptoms, I just want to make sure, and to the isolation and what to do, how to deal with the family, with friends, going out and everything else. I can tell you right now that the recommendation has not changed. If you get tested and test positive for COVID, basically you need to make sure that you isolate yourself, the best way possible. There's no quarantine that you have to really stay home and everything else. The best way possible, from yourself, you isolate yourself from other people, from family members, even within the same household, and try to always wear a mask. Make sure that you always wear a mask. You don't want to give it to anyone for 5 days from when the first symptoms started, and that's important. It's not when you test positive and when you started feeling the first symptoms. We don't see the fever as much as we used to before, but fever can still be a symptom of the COVID infections, very low grade, not as high like before. Sniffle, it's not really because the sniffle can continue even after you're completely cured of the COVID. You're better off. But so if you don't have any major cough, fever, or very other significant symptoms, after 5 days from when the symptoms started, you can venture out and you can actually just wear the mask for another 5 days or so. After 10 days, it's not required that you test yourself. But if you do, for example, go to a family gathering, to a wedding, to an event where you could potentially be a super spreader, I always recommend you test yourself to make sure that, even for yourself, just to tell people, listen, I had COVID, but I tested myself, I'm negative. We do have the COVID test 99% sensitive and specific in North Haven. We still do them outside, and we can arrange it, and you can go anytime between 8:30 and 4 o'clock in the North Haven office. A lot of you have done it, and you would get the actual result within 15 minutes. So that's the nice thing about that. It's a very high sensitivity specificity. It's way better than the home test. So we still go by the home test. Sometimes we don't need the confirmation by those, but if you have to choose, or if you have the time to go there, definitely do that, because that gives us also 100% confidence that you did indeed contract the COVID. Now, in terms of the other viruses, the flu and the RSV. The flu, we're talking about the combined flu and COVID shots. Now it's also going to be the time to get the flu shots, the new updated flu shots, and I believe Janine has already gotten some of them in. We always recommend the flu shots to be dispensed between, I would say, Halloween and Thanksgiving. It's always a nice way of remembering that. But basically, end of November, middle of November, we actually continue to distribute the flu shots even after that. Around the holidays, even with the new year. Sometimes we'll have people that get the shot in January, February. If you forget, if you're not able to get it, it's never too late. And we encourage that, because sometimes the flu season expands into April, May. And so we want to make sure that at least you have a good level of immunity by then. Even this year, we're going to have the Fluad, the quadrivalent flu vaccine for over 65, and the regular one for the general population. So, but that has happened for the last few years. Once again, how to react to the flu shot, and we'll be there for you, and we'll let you know when you can come in. And if I see you in the office for your physical or for just follow-up visits, we'll do that at that time as well. So just make sure that you mention to Janine, but we'll definitely, she's going to ask you, going to ask everyone once we start giving it. RSV, it's another vaccination that just came out in the last year or so. Let's face it, it's way more important for infants, kids, and pregnant women. But it's also important for elderly people. Right now, the recommendations are everybody above age 75 should get one in a lifetime, and above age 65 and with comorbidities, they should get once in a lifetime. Even though the insurance, and I believe Medicare as well, just cover everybody above age 60. So it's one of those that should not probably be given with the other ones. We still don't have a great experience. I was waiting to get the first data regarding the tolerability of this vaccine, but it seems to be very tolerable. There were some early reports of cardiac events, arrhythmias, which have not proven to be true. They're very effective, and once again, the vaccine is about 80% 85% effective. So definitely I would recommend it. We don't give the RSV right now, and that's once again another vaccine that you can get into the pharmacy. The best time to get it actually is before or just at the beginning of the winter season. So I would say probably by the end of the year, December, January. In terms of the treatment for, besides the vaccines, the treatment for COVID, I mentioned the antivirals, like Tamiflu for the flu. We have Tamiflu, which is a great 5-day antiviral. And the Paxlovid and the Molnupiravir they're all like combination medication antivirals. They've been around for at least over 2 years. And we've been prescribing a lot of Molnupiravir over the last 2-3 years or so. It's a very good, very safe, very tolerable antiviral. It doesn't have the metallic taste that Paxlovid has. Paxlovid is very powerful, but has two drawbacks. One is the metallic taste that for some people really it's not that great. And second is the rebound effect. Even though Molnupiravir also can have a rebound effect, we've seen most rebounds. In other words, when you test positive again after you tested negative for COVID 5 days later. There's something definitely that can happen. So, but between the two of them, they're both for 5 days. And remember, it's important for people to start taking these medications, the antiviral, if they're candidates. And once again, there's some people that, especially younger people, that can go through it without any issue whatsoever. I don't recommend that. For people over 65, I would say, especially if they have diabetes, kidney disease, cancer, or history of cancer, I would definitely recommend the Molnupiravir or Paxlovid. And that's for two reasons. One is to avoid hospitalization, and second, to speed up the recovery. We've seen that people who are taking this medication usually start feeling better faster than people who don't take any medication whatsoever. So those are available. Once again, it's a hit or miss in terms of the insurance coverage and Medicare. Some pharmacies will not carry both; will just carry one or the other. And sometimes, of course, the supply is not the best at the pharmacies. But in any case, we usually talk to the pharmacy, and if it's not, I always give them my cell phone number. And if they don't have one, they'll be able to give you the other. Once again, if we have a conversation and we decide that it's the right thing for you to go on the antiviral. So overall, a much better situation than the one we were in, even just 2 years ago. Forget about 4 years ago. That's way better. And we have so many more weapons right now. But it's nice, important to have the good information to be able to educate other, in your family, in your circle of friends, and to be able to know exactly what to do. And that's one of the things that most people have problems with. There's still so much confusion that they really don't know what to do. And of course, you have a preferential pathway to get in touch with us. You can know almost immediately what's good for you. But for other people who need to get an appointment to their doctors and everything else, it might get really confusing and frustrating. So those are the information that I wanted to give you. I'm gonna unmute you all. And I'm going to go on to the, let me see, where am I here? And I'm going to go on, let's see, mute, allow everybody to mute. And let me see. And I might have to unmute you one by one. Okay. All right. Can you guys hear me?
Yes. Wendy.
Okay, great. Hi, Wendy. How are you?
I'm doing great, Dr. P. How you doing?
Wendy. Good. Bob, can you hear me? 1 second. Let me unmute you all. It tells me that you must have received a request to unmute yourself.
This is Bob. I'm all set.
Okay, great. Awesome. Yeah, I can hear you. Carol, are you good? Can you hear me? Can you guys hear me?
Yes.
Yep.
Yes.
Awesome. Great. Do you guys have any question?
So, Dr. P, going back to uh,
Yes.
what happens? What happens um, after 5 days, right? After 5 days, if you, what happens if you still test positive after 5 days?
Once again, you're not recommended to test yourself again. That's the most important thing. If you test positive, there's really no reason for you to test again unless you really have to, attend an event,
Okay.
okay? Or if you want
Okay.
to know, if you have a curiosity of knowing, but there's really no reason.
Okay.
Go by the symptoms. And once again, remember, the first 5 days of symptoms, you got to wear a mask and try to
Right.
isolate from other people.
Okay.
After those first 5 days, the next 5 days, you can go out, you can go to Stop and Shop, you can go ShopRite, wherever you want to go. Just wear a KN95 mask and you should be fine. All
Okay.
right. You
Thank
don't
you.
have to retest yourself, and only do that if you have to attend an event.
Okay. Thank you.
You're welcome. Anyone else?
You sure? Okay.
All right. Well, great, guys. I'm gonna see you in the office at one point or the other. If there's any issue, just let me know. We're gonna just schedule a few more updates over the season. But right now, this is the latest information, and we'll look forward to seeing you. Have a great rest of the summer. And if there's any issue, of course, you know that we're in touch with you every day. All right,
Thanks.
guys.
Thanks, Dr.
Have a
P.
great day, everybody.
Yeah.
Thanks,
Thank
Dr.
you.
P.
You're welcome.
These
Take care,
updates are
guys.
really helpful. Thanks a lot.